I was assigned video 5 discussing insurance coverage through the Affordable Care Act. During this video, both Republicans and Democrats discussed their views on how to better expand insurance coverage to millions of uninsured Americans. The major law discussed was the Affordable Care Act, which could provide insurance coverage for 30 million uninsured citizens. This act included the expansion of Medicaid. According to a study by Kenney, Lynch, Haley, and Huntress, Medicaid expansion could provide insurance coverage for up to 15 million adult Americans who do not currently have health insurance coverage. This expansion could provide extensive coverage for many Americans with chronic health conditions. According to a study by Cope, prevalence rates for chronic health conditions are more likely in Americans living in below poverty level income brackets. This means that the expansion could cover cost of acute care, hospitalizations, and prescriptions. Another improvement in care for these citizens would include the coverage of preventative care. One argument for the ACA is that by providing preventive coverage for uninsured, it could decrease the cost of emergent care. By providing these patients care in a primary setting, we could potentially decrease the lengthy and expensive hospital stays that will occur down the road without the coverage. With a possible solution to one problem, a new one is born. With the influx of patients receiving primary care, it becomes essential that America has enough primary care providers to adequately treat patients in a timely manner. A study conducted by Hoffer states that since primary care physicians typically serve as the point of entry into the healthcare delivery system, an adequate supply is critical in meeting the anticipated increase in demand for medical care resulting from the expansion of coverage. Policymakers may now need to turn their attention to providing incentives to attract more primary care physicians to meet these heightened demands. 3 things that I learned this semester. I learned a lot more about the Affordable Care Act. I learned how it will affect providers as well as those who could potentially receive insurance coverage under it. I also learned more about the different schools of thought, including the deontological and utilitarian schools of thought. And I learned how the different branches of government collaborate and work together to change healthcare policies into laws, and how both legislation and regulation govern the practice of the healthcare field.